questions focused on the superficial inguinal lymph nodes, their drainage regions, distal vagina, vulva, scrotum, anal canal below pectinate line, and skin below umbilicus, and associated conditions like STIs and lower limb cellulitis. Question 1. A 26-year-old woman presents with a painful ulcer on her labia majora and bilateral inguinal lymphadenopathy. She reports recent unprotected sex. Which of the following lymph node groups is primarily involved? A. Internal iliac, B. External iliac, C. Superficial inguinal, D. Para-aortic, E. Inferior mesenteric. Correct answer C. The superficial inguinal lymph nodes drain the vulva, distal vagina, and skin of the perineum, making them the primary site for sexually transmitted infections in external genitalia. Why not the others? A. Internal iliac equals proximal vagina, cervix. B. External iliac equals superior bladder, uterus. D and E. Not involved in perineal drainage. Question 2. A 35-year-old man presents with redness, swelling, and warmth over the medial aspect of the lower leg. He also has tender right inguinal lymphadenopathy. Which of the following best explains the nodal involvement? A. Lymphatic spread to popliteal nodes. B. Venous drainage into femoral vein. C. Direct drainage into para-aortic nodes. D. Lymphatic drainage to superficial inguinal nodes. E. Hematogenous spread to axillary nodes. Correct answer? Lymphatic drainage to superficial inguinal nodes. Cellulitis of the medial foot or leg drains to the superficial inguinal lymph nodes. This is why infections in this area can cause tender inguinal lymphadenopathy. Why not the others? Popliteal, lateral foot, and posterior calf. B and E. Venous hematogenous spread equals not lymphatic. C. Para-aortic equals drains testes/kidneys. Question 3. A 58-year-old woman presents with a painful anal ulcer. On exam, the lesion is located below the pectinate line, and there is bilateral inguinal lymphadenopathy. Which lymph nodes are most likely involved? A. Internal iliac, B. External iliac, C. Inferior mesenteric, para-aortic, E. Superficial inguinal. Superficial inguinal? The anal canal below the pectinate line drains to the superficial inguinal lymph nodes, so infections or cancers here often present with inguinal lymphadenopathy. Why not the others? A. Internal iliac equals drains above the pectinate line. B and C drain deep pelvic or GI structures. D. Para-aortic, deep organs like kidneys and gonads. Would you like